Hello, I'm David Kerr, Professor of Cancer Medicine at University of Oxford. I'd like to talk today about, I think, an important study that's been published in Future Oncology by a pal of mine from the old days, Professor Jackson Oram, and his colleagues from the Ugandan Cancer Institute in Kampala. It's a really nice study in which they have set about in a very sort of highly focused way to improve procurement of anti-cancer drugs, those which are on the WHO Essential Medicines list, for their patients. They've done a remarkable job. We know that expenditure in cancer drugs globally is rising exponentially. In 2013, it was estimated that we were spending around $90 billion a year on anti-cancer medicine. By 2022, it's estimated that this will have risen globally to around $200 billion a year. Now, we've talked many times before that increasingly the burden of cancer in the future will start to fall in those low and middle income countries, which in some aspects are least well prepared to deal with this advancing burden of cancer, this tsunami of disease which we'll be facing over the next couple of decades. And access to cancer medicine, I think, is one of the elements of any national cancer control plan. Jackson and colleagues have put together a really important map as to how other colleagues in low and middle income countries might take this sort of approach to better procure cancer medicines. There were 5 strands as to how they went about it. One was redefining cancer medicines as highly specialised drugs. This was important in terms of the legalities in Uganda as to how drugs were procured by central government. This responsibility was given legally to the professionals at the Ugandan Cancer Institute on behalf of the whole country. Streamlining the procurement and supply chain. So there's a really complex ecosystem in terms of getting drugs from the manufacturers to the clinical front line, with lots of opportunities for drug costs to be marked up along the way. And therefore they went directly, as a group, to the manufacturers of these essential cancer medicines. And by cutting out a whole series of middlemen, by managing their own drug supply, by storing it under the appropriate situation, they managed to hugely simplify the drug supply chain and also reduce the possibility of counterfeit drugs. You've no idea how common that is in low and middle income countries, something that we rarely think about in the north and in the west, but is a huge problem. It is a huge problem in low and middle income countries. So they went sort of directly to the manufacturers and did a good deal with them. Collaboration with stakeholders. This is a beautiful example of joined up government, the Ministry of Health, the Ministry of Finance, of working together with citizens, with ministers to come up with and to legalise this plan. That also went in with the first point about creating this legal structure that the Ugandan Cancer Institute could procure these highly specialised drugs as a carved out area for them to be able to deliver on their own. And I think finally, access initiatives, working with overseas partners, the Clinton Foundation, other NGOs, access initiatives from the pharma companies and so on themselves. Within a couple of years, they were able to demonstrate remarkably that their essential cancer drug access went up from around 30% to 85%. I mean, fantastic. But not only that, so drug access improved with the same budget, and they estimated that there had been budgetary savings of around $2 million. I mean, it's a remarkable win-win story. Now, this is a great group. They're highly organised, hugely trusted by government. They are the Ugandan National Cancer Institute, and therefore they're of standing. They have great status within their own country. But, you know, a fantastic story that one would hope that we could amplify and repeat elsewhere. what stories might we take out of this? Concerted, focused action, joined up government, perhaps that idea that each of the sub-Saharan African nations should create a national cancer centre with the sorts of legal procurement powers that were granted to my friends and colleagues in Kampala, something that might move forward that way, and therefore not only making sure that the drugs can be procured, but that they can be delivered, that there will be socio-economic impact to those countries also. It's a great story, and it's a hopeful one. It's a hopeful one that there's a piece of work that we can take and use and learn from and see how we can apply it elsewhere and increase access to essential cancer medicines, the bread and butter of the drugs that we need to do the best that we can for the communities that we serve. Have a look at it. It's quite an inspiring piece of work. It genuinely is. Thanks for listening. And for the time being, Medscapers ahoy. Thank you very much.